Hi everyone, today I'm going to be talking about mental health in the elderly population. So, first we have mental health changes. Um, Mental health is a common, but it's often ignored, especially in older adults. The World Health Organization found that as of 2013, approximately 15% of adults over the age of 60 suffer from a mental health disorder. And I think a lot of times it's confused with symptoms of people confuse symptoms of mental illness as normal signs of aging. I think we often think that, older people are always just sad or they don't want to do anything and that's just normal, but that is not. Mental health disease can cause mild to severe disturbances in thought or behavior, resulting in just an inability to cope with life's ordinary demands. Um, and 6 million Americans over the age of 65 are affected by depression, and as many as 5 million Americans have Alzheimer's disease. Some common diagnoses of mental health disorders in the elderly population are anxiety disorders, PTSD, schizophrenia, psychosis, bipolar disorder, depression, suicide, and alcohol use disorder. And later on in the presentation, I'll be talking about how my step grandpa um, has depression as an older adult and kind of what that looks like for him. Some risk factors of mental health disorders as an older person may include um, alcohol or substance abuse, changes in environment like moving to an assisted living, which I'm sure, as you can imagine, it would be hard to move and have so much in your world change and lose so much independence. And that can really put you at risk for a mental health disorder. Dementia causing illnesses and illnesses or loss of a loved one can be really hard and kind of put a person at risk. Long-term illnesses also can be really like draining and really hard on a person and put them at risk for a mental health disorder, as well as medication interactions, which we talked about earlier in this class, a physical disability, physical illness that can cause or affect emotion, memory, and thought, as well as poor diet and malnutrition. My step grandpa lost his daughter pretty suddenly, as well as his parents a couple years before that, which really put him at risk and made him kind of fragile. He also deals with several different long term illnesses that have really worn on him over several years. And with that, has had medication interactions in the polypharmacy that we talked about in this class, um, and also like physical disability caused by those illnesses. And so, with that, it really put him at risk for depression as an older adult. Some symptoms of mental illness might be changes in appearance or dress, or problems maintaining the home and yard, confusion, disorientation, problems with concentration or decision making, as well as a decrease or increase in appetite, which results in a change of weight, a depressed mood lasting longer than 2 weeks, feelings of worthlessness, inappropriate guilt, helplessness, thoughts of suicide are all symptoms. Memory loss, especially recent or short term memory problems, and physical problems that can't be otherwise explained, like aches, constipation, social withdrawal and loss of interest in things that used to be enjoyable, and trouble handling finances, working with numbers, real kind of fine and complicated things, and unexplained fatigue and energy loss or sleep changes are all symptoms of a mental health disorder. My step grandpa definitely had changes in dress, kind of didn't take care of himself as much as he used to, and had a quite a decrease in appetite, which resulted in a great loss of weight. And he definitely had like a depressed mood lasting more than 2 weeks. I think kind of when we really started noticing um, changes, he had been depressed for maybe a couple months, and definitely had like feelings of worthlessness, like it didn't matter if he was here anymore. um, as well as like physical problems, and that was difficult to, um, I don't know, decide if that was depression or if that was really some of these like pathological like diseases that he has had. And I think there's really just such a fine line that it was difficult to ever kind of figure that out. He definitely had social withdrawal and a loss of interest. He noticed that he stopped coming to a lot of like family events or holidays and stuff that he used to come to and enjoy. So for mental health assessment in an elderly person, the American Academy of Family Physicians provides a geriatric assessment that helps in screening for mental health diagnosis as well as other changes in other conditions. This the geriatric assessment is a like multidimensional, multidisciplinary assessment. So like nurses and doctors will be using this, and it helps like evaluate the person's just ability, health, cognition, um, and it's very extensive. It is also recommended that screening adults for depression is used and has systems in place. There are several other validated screening instruments for depression specifically. The geriatric depression scale and the Hamilton depression scale are some of the easiest to use and the most widely used and accepted. However, there is also like a two-step question screening tool um, that includes just two questions. One is, during the past month, have you ever been bothered by feelings of sadness, depression, or hopelessness? And also, have you often been bothered by a lack of interest or pleasure in doing things? And just this two-step question screening tool is effective, or seen to be just as effective as these longer scales. And responding yes to one or both of these questions is a positive screening test for depression and requires further evaluation. So some pathophysiology of mental health. Um, these causes of depression and mental health disorders in older adults, they're complex as they are mental health disorders in any patient, and factors such as health, gender, developmental needs, socioeconomics, environment, personality, losses, functional decline are all really significant to the development of depression later in life. Depression can occur for the first time in late life or can be part of a long standing mood disorder that someone's had throughout their life. Compared with patients with early life depression, older patients with late onset major depression have less frequent family histories of mood disorders. Um, some biological causes, such as neurotransmitter imbalances, have a strong association with many depressive disorders in late life. This may be a factor in the high incidences of depression in individuals with neurological conditions such as a stroke or Parkinson's disease or Alzheimer's disease. Some high rates of depression are seen with individuals with dementia, and depression is also a risk factor for dementia, particularly early onset, recurrent, or severe depression. Serious symptoms of depression occur in up to 50% of older adults with Alzheimer's disease, and major depression occurs in about 25% of these cases. Depression in individuals with Alzheimer's disease may be due to an awareness of the progression of decline and knowing what is happening to them. Research suggests that there may be biological connections between depression and Alzheimer's disease as well. Among patients who have suffered like a CVA, the incidence of major depression disorder is approximately 25%, with rates being close to 40% of patients with Parkinson's disease. Some medical disorders and medications can also result in depressive symptoms. Other important factors, including the development of depression, are alcohol abuse, loss of a spouse or partner, loss of social supports, lower income levels, and caregiver stress. Kind of like I talked about earlier on in this presentation, just risk factors for depression. Um, so, as far as health promotion, the mental health in older adults can be improved through promoting active and healthy aging. Mental health specific health promotion for older adults involves creating living conditions and environments that support well being and allow people to lead a healthy life. Promoting mental health depends largely on strategies to ensure that older people have the necessary resources to meet their needs. And some of these would be providing security and freedom, adequate housing through supportive housing policy, social support for older people with their caregivers, health and social programs targeted at vulnerable groups such as those who live alone and rural populations or that suffer from a chronic or relapsing mental or physical illness, programs to prevent and deal with elder abuse, as well as community development programs. As far as interventions go for a mental health diagnosis, prompt recognition and treatment of mental, neurological, and substance use disorders in older adults is essential, both for psychosocial interventions and medications. There are no medications currently available to cure dementia, but there's a lot that can be done to support and improve the lives of the people with dementia as well as their caregivers and families. Some of these are an early diagnosis in order to promote early and optimal management, optimizing physical and mental health and functional ability and well being, as well as identifying and treating accompanying physical illnesses, and detecting and managing challenging behaviors and providing information and long term support. And so, family teaching is also important for both the patient and for the family who's taking care of the older person with a mental illness. This is important to know that there are professionals out there that are wanting to help, including a family doctor, and the family doctor is a great place to start. And they may encourage your family member to consult a counselor, a geriatric psychiatrist, or a psychologist if there are concerns of a mental health diagnosis. It is also important to know that the suicide rates are particularly high among older Americans. Those who suffer from depression are at the greatest risk. And so do not ignore remarks about suicide, especially if there's a history of suicide in your family. Report any concerns of suicide to your loved one's doctor and encourage the relative to seek treatment immediately. Firearms pose an increased risk of suicide in older adults, and if there are firearms in the home, remove them as soon as possible. As well as for more advice, call the National Suicide Prevention Lifeline.